I actually wrote a series of articles back in October, I think, like on COVID fatigue. So it's COVID positive fatigue, and it's like, are you fatigued? Like, because um, this is something like trauma that all of us are going through. The world as we know it is not safe anymore.
Yeah.
So it's like being in a war zone. You're like, you don't know what's going to happen when, and you are constantly under the trauma of it. And most often, what we are seeing in people is, I mean, I've like actually, we've noticed an increase in clients who come with the first question I ask them these days is like, did you have COVID? Did somebody around you have COVID? What do you feel about the whole situation? So it's like, it's become a pervasive thing, and a lot of people are having PTSD symptoms, like post-traumatic stress disorder. It's like it comes from being on the survival mode, hypervigilance mode constantly. And we don't have a deadline. We don't have an exit route.
Correct.
We don't see it. And that is getting to us. And I will share those articles with you. I've listed things that you can look out for. Fatigue wise, what can you look out for? What can you possibly do? But again, like if you feel overwhelmed, it's always, like you can always reach out and get help. But and often once you start recognizing like what you can do and what you're experiencing, and the disease itself seems to have, in my opinion, some kind of bearing on the cognition and emotional well-being of the person. I don't know. I mean, it's too soon to say if it's because of the hype or because of the disease itself.
Okay.
Yeah. So it's too soon, but COVID fatigue is real. And if you feel overwhelmed, reach out. It's something that we can work with, and often people get to a better mental space, emotional space, like post like working through it.
Okay.